Menopause marks a significant transition in a woman's life, bringing with it a cascade of physical and emotional changes. Among the most commonly discussed, yet often misunderstood aspects of this transition is its impact on sexual desire and function. For many women, changes in libido during menopause can feel confusing, frustrating, or even isolating. Understanding the complex interplay of hormones, physical symptoms, psychological factors, and relationship dynamics can empower women to navigate this phase with confidence and maintain a fulfilling, intimate life. Understanding the hormonal state. The heart of menopause lies a dramatic hormonal transformation. As women approach perimenopause, typically in their 40s, the ovaries gradually produce less estrogen and progesterone. By the time menopause arrives, defined as 12 consecutive months without a menstrual period, these hormone levels have declined significantly. Testosterone, though present in smaller amounts in women than men, also decreases during this time. Estrogen plays a crucial role in maintaining vaginal health, lubrication, and blood flow to the pelvic region. When estrogen levels drop, the vaginal tissues become thinner, less elastic, and drier, a condition known as vaginal atrophy or genitourinary syndrome of menopause. These physical changes can make sexual activity uncomfortable or even painful, naturally leading to decreased interest in sex. Testosterone, often associated primarily with male sexuality, is equally important for female sexual desire. This hormone influences libido, arousal, and overall sexual satisfaction. The decline in testosterone during menopause can directly dampen sexual desire, making women feel less interested in initiating or engaging in intimate activities. The physical symptoms that affect intimacy beyond hormonal changes. Menopause brings a constellation of physical symptoms that can indirectly impact sexual desire and function. Hot flashes and night sweats, experienced by up to 75% of menopausal women, can disrupt sleep quality and leave women feeling exhausted. When you're sleep deprived and fatigued, sexual desire naturally takes a backseat to the basic need for rest. Vaginal dryness is perhaps the most direct physical barrier to comfortable sexual activity. Without adequate natural lubrication, intercourse can cause friction, discomfort, or pain, a condition called dyspareunia. Many women report that even with arousal, their bodies don't respond as they once did, creating a frustrating disconnect between mental desire and physical readiness. Weight gain and changes in body composition are common during menopause, with many women experiencing increased abdominal fat despite maintaining their usual diet and exercise routines. These changes can affect body image and self-confidence, making some women feel less sexually attractive or desirable. When you don't feel comfortable in your own skin, it's understandable that you might not feel particularly interested in intimate encounters. Additionally, decreased blood flow to the genital area can reduce sensitivity and make arousal more difficult to achieve. The clitoris and vaginal tissues may become less responsive to stimulation, requiring more time and effort to reach the same level of arousal that once came more easily. The psychological and emotional dimensions, the impact of menopause on libido extends far beyond the physical realm. This life transition often coincides with other significant stresses and changes that can affect mental health and sexual interest. Many women in their 40s and 50s are juggling demanding careers, caring for aging parents, supporting children or young adults, and managing household responsibilities. This perfect storm of obligations can leave little energy or mental space for sexual intimacy. Depression and anxiety rates increase during the menopausal transition. The hormonal fluctuations themselves can contribute to mood changes, but so can the psychological adjustment to aging and this new life phase. When you're feeling down, anxious, or overwhelmed, sexual desire often diminishes. The brain, after all, is the most powerful sexual organ, and psychological well-being is intimately connected to sexual well-being. Some women experience a sense of loss during menopause, mourning the end of their reproductive years, even if they don't want more children. Others may feel invisible or less feminine, as society often equates youth with desirability. These existential concerns can manifest as decreased sexual confidence and interest. Conversely, it's important to note that not all women experience negative psychological effects. Some women report feeling liberated after menopause, freed from concerns about pregnancy and menstruation. For these women, sexual satisfaction may actually improve during this phase of life. Relationship factors and partner dynamics. Desire doesn't exist in a vacuum. It's profoundly influenced by relationship quality and partner dynamics. For women in long-term relationships, menopause occurs within the context of a partnership that has its own history, patterns, and challenges. If communication about sexual needs and desires was already difficult, menopause can amplify these issues. Partners may also be experiencing their own age-related changes. Male partners might be dealing with erectile dysfunction, decreased libido, or other health issues that affect sexual function. When both partners are navigating changes, it can create a cycle where neither person initiates intimacy, leading to a gradual decline in sexual activity. On the other hand, strong relationships characterized by open communication, emotional intimacy, and mutual support can weather the challenges of menopause more successfully. Partners who are willing to adapt, explore new forms of intimacy, and prioritize each other's pleasure can often maintain or even enhance their sexual connection during this transition. The quality of sexual experiences before menopause also matters. Women who had fulfilling sex lives and positive associations with intimacy tend to be more motivated to address menopausal challenges and maintain their sexual relationships. Those who had unsatisfying or problematic sexual experiences may see menopause as a convenient exit from an aspect of life they didn't particularly enjoy. Medical conditions and medications. Health conditions that become more common with age can independently affect libido. Diabetes, cardiovascular disease, thyroid disorders, and chronic pain conditions can all dampen sexual desire and function. Additionally, medications used to treat these conditions including certain antidepressants, blood pressure medications, and antihistamines commonly have sexual side effects. Women who have undergone surgical menopause, where the ovaries are removed, often experience more abrupt and severe symptoms than those who go through natural menopause. The sudden drop in hormone levels can lead to more pronounced changes in sexual desire and function. Strategies for maintaining sexual health. Understanding that changes in libido during menopause are normal and common is the first step toward addressing them. The good news is that numerous strategies can help women maintain sexual health and satisfaction during and after this transition. Hormone replacement therapy (HRT) can be highly effective for managing menopausal symptoms, including those affecting sexual function. Systemic HRT delivers estrogen throughout the body, while local vaginal estrogen specifically targets vaginal and urinary symptoms. These treatments can restore vaginal moisture, elasticity, and comfort during intercourse. Some formulations also include testosterone to directly address decreased libido. However, HRT isn't suitable for everyone, and the decision to use it should be made in consultation with a healthcare provider, considering individual health history and risk factors. Non-hormonal medications are also available for treating specific symptoms, like hot flashes. Vaginal moisturizers and lubricants are simple yet effective tools for managing vaginal dryness. Regular use of moisturizers can improve vaginal tissue health even between sexual encounters. While lubricants can make intercourse more comfortable and enjoyable, maintaining sexual activity itself can help preserve vaginal health. Regular sexual activity increases blood flow to the genital area and helps maintain tissue elasticity. The phrase "use it or lose it" has some truth when it comes to sexual function. Pelvic floor physical therapy can address issues like pelvic pain or decreased sensation. Specialized physical therapists can teach exercises to strengthen pelvic floor muscles, improving sexual function and overall pelvic health. Lifestyle modifications also play a crucial role. Regular exercise improves mood, energy levels, body image, and cardiovascular health, all of which positively impact sexual function. Managing stress through mindfulness, yoga, or other relaxation techniques can create mental and emotional space for intimacy. A balanced diet and adequate sleep support overall health and well-being, communication and intimacy. Perhaps the most important tool for navigating sexual changes during menopause is open, honest communication with your partner. Discussing your experiences, concerns, and needs can prevent misunderstandings and foster intimacy. Many partners are willing to adapt and explore new approaches to physical intimacy but need guidance about what feels good and what doesn't. Redefining intimacy beyond penetrative intercourse can open new avenues for connection and pleasure. Sensual massage, extended foreplay, oral sex, and manual stimulation can all be satisfying forms of intimacy that may be more comfortable or appealing during this phase of life. Removing the pressure to have intercourse can actually make sexual experiences more relaxed and enjoyable.